needed for the perineal repair. So now we have ready for the perineal repair. Here we have a pelvic model and with the right mediolateral episiotomy. We have our tray, needle driver, tooth pickup and straight scissors and suture material for of your choice. My preference is 20 vicryl and using today during this repair. Step 1 is a closure of the posterior vaginal wall. So let's get started. I am going to use 20 vicryl as my suture preference to do this repair, and I am getting ready to start the apical portion of the repair, the horizontal portion with my apical stitch. As you can see that I am going high above the actual point. The reason being of this laceration so that I can make sure that I get all of the arterioles that may have lacerated, retracted, and in the syphil direction a vaginal hematoma can be prevented. So we have to take this. Now we are going to tie it and I'll cut it the short suture. After this, now I am ready to start the repair of the posterior vaginal wall with a continuous lock stitch. In order to place a continuous lock stitch, the entry point of the needle should be placed at the insertion point, maternal left side of the laceration, and then will be passed across the sideways to the maternal right side where the exit point, and then you will lock the stitch and run all the way to the hymenal ring in the same fashion. Step 2 is a closure of deep muscles. So now I have to run the continuous stitch, lock stitch with 20 down up to the level of hymen ring, and then crown stitch is being taken. However, it's my recommendation that it would be that what a practice is my own perineal repair that I do. I choose to protect this needle on the hemostat, this, and put on the other side. Then I would take another needle and a separate needle to place a deep interrupted sutures into the deep vaginal space, the mucosa, to prevent perineal hematoma. And sometimes, depending on the perineum, it might take 3 sutures close to the dead space, needle with driver, and passing the needle in the deep tissue all the way across and coming at the same level of the other side, and then basically pull it through to the deep structure inside this perineal body. Now we are ready to do the crown stitch. What is crown stitch? Step 3, crown stitch. The crown stitch, so that we will bring the horizontal portion of the suture down into the vertical area and just pass tissue through it and needle into the posterior vaginal wall. And now we are going to secure the horizontal stitch with the crown stitch. And in order to place the crown stitch, that we do is we go deep, superficial on the maternal right side, and then the hand will go this side, go superficial deep, and then the way and then we bury the crown stitch on the posterior vaginal wall. And there is no suture is needed, and the vaginal 6 o'clock position is important for healing and for the intercourse later on when the women become sexually active. So I am passing the suture deep and then superficial into this side of the maternal pelvis, and I will not pull the suture through the quiet yet. So I am going to ask my assistant to hold it up, and I am going to reload my needle and ready to drive this suture now on this side, and we will be going superficial and deep, and this is the crown stitch. Step 3, crown stitch again. So we are going the superficial to deep this direction, and as I pull this through, you will notice there is a new loop being made by the suture itself, and that is the loop is right here. So we are going to pull that and pull on the suture, the new loop, and so that you will all see the loop is disappearing, and that's the magic trick. So how I bury the knot? So the suture like this, and we are going to tie the knots. And result, now we have buried the crown stitch deep inside her perineum, and it will never cause her problems at the 6 o'clock location in terms of dyspareunia. So careful, then we cut this and particular suture here, and then you don't cut it down so that you can go down short stitch holding the posterior vaginal wall together. Now horizontal portion, the perineal repair is complete. So the closure of the vertical portion of the perineum, that's a step 4. And now we are ready to to start the vertical portion of the repair. So you might remember that we are going a pelvic model. So you have a deep structure ready inside, and prior to placing the crown stitch, the present there and they are closed part, the posterior vaginal wall. But here there is a perineal body, and the part remains, so must close this area in layers. And I would put probably a deep simple interrupted sutures just like that, and this angle to reduce the deep space, and then we'll proceed to the next layer. Now close the subcutaneous layer by subcuticular stitch in 2 layers in a perineal closure, and I am going to close with a subcutaneous layer called a horizontal mattress stitch. So I enter here and enter on the other side and then come up contralateral, and this will we make a boxed kind of a stitch as a point A, point B, C, and we can do it. Provide the more strength to the perineum, and also provide another layer of suture so that we have a superficial wound infection or dehiscence will be less, and we have tissue to hold together perineum together. Now here we go, we are just completing the horizontal mattress stitch. And now I will tie this, and just want to show you that how things went well, and the pointer of A entry and then came down here point, and C and D, and see how it looks. It brings the tissue together very nicely, and then all you will have the remaining subcuticular layer at the end. So at that example, the horizontal mattress stitch is being taken, and now I am going to do the continuous, place another here and to right at the apex, and then we will provide an excellent approximation of the subcutaneous layers. And now step 5 is the subcuticular closure of the sin. This is a final layer that will be placed subcuticular stitch anchored here at the apex of the episiotomy, working by backs through the hymenal ring. So I am going to anchoring stitch with 20 vicryl, and that way we bury the knot, and then we can start the subcuticular in the direction of upwards direction. We can start directional towards the hymenal ring, towards the apex of the laceration in the deep tissue, and in this way I will knot the buried knot into it. So you will watch this suture disappear into the perineum and into the perineal body, and now buried when we run to the subcuticular upward direction towards the now take a small bites at the beginning, and you hold your needle holder, and in this way it's easy to pass the needle back and forth, and in this way the apex of the laceration will be nicely placed together, staying in the epidermis, dermis layers. Follow the curve of the needle throughout the stitching, and do it stepwise and very nicely, and working side to side almost in the zigzag fashion. Putting the final layer of the closure, so you can see that I have run a subcuticular stitch on all the perineum. Now nicely skin has come together, and I am ready to finish this by placing my final stitch. Just inside the deep tissue, bury this final stitch, then the perineal repair is complete. So I am going to take deep bite inside the tissue here, and going to from one side to the another side, and then come through them, and I will use this loop, previous one, then very last loop, and to tie the knot, then the subcuticular, and bury it into that position is complete. So now you can see that the knot has been buried inside the bone vessels. And there you go, and case the perineal skin here didn't. But sometimes reinforcement stitches, they came together exactly perfect when we would like. This is another option to close the skin here, which is quite on the tension is it place a vertical mistress stitch. Just on the skin through the even simplified interrupted. So I'll show you the example of vertical mistress stitch. So we go far and always the same amount of skin on the both sides and feed it through. So while doing it, then you would go near to the back towards to the other side, and we will give it the mattress sutures, always in the same line, always following the curve of the needle, and first the deep one and then the superficial on the both sides, and then leaving the stitches on the skin like this. And there is nothing wrong in that it's just fine to do this on the tissue that is on the stretch. Tension must be right, and in the mediolateral episiotomy. And this is an example of the vertical mattress stitches. It can be given the multiple, and the other option put a simple interrupted through skin to skin, just like this. So the way is another way. So just telling you that we can do the simple mattress suture, or the better approximation of the skin, we can do it with a simple mattress sutures. These last two stitches I am just showing you. Now the concluding comments about it are, they look like a perineum. Here is an example of the vertical mattress sutures will be look like, and then we can do either we can do the subcuticular or the simple interrupted sutures or the mattress sutures. Just choose what you feel the best, from the apex to the hymenal ring, and had done like this. And there can be just variations from one person to another. So there it is as a right mediolateral episiotomy. Thank you so much.